When we think of physical therapy, we might imagine strenuous exercises or complex machinery. However, some of the most effective treatments are surprisingly gentle and rely on the skilled hands of a therapist. One such technique is called Maitland mobilization. It is a specific type of manual therapy used by physical therapists all over the world. The core idea is simple but powerful: to use small, controlled movements to help a stiff or painful joint move better. It's not about forcing anything. Instead, it is a careful and precise conversation between the therapist's hands and your body's joints. This method was developed by an Australian physiotherapist named Geoffrey Maitland. He believed that the key to treating joint problems was a very detailed assessment, followed by a highly specific, gentle, hands-on approach. Unlike some other treatments that might follow a rigid protocol for everyone, Maitland mobilization is completely tailored to you. The therapist continuously listens to your feedback during the treatment. They are constantly adjusting the technique based on how your pain and stiffness respond. This makes it a very personal and adaptive form of care, designed to work with your body, not against it. Let's imagine you have a stiff neck that makes turning your head difficult, or perhaps a sore shoulder that aches every time you reach for something on a high shelf. These are common problems that can significantly impact daily life. Maitland mobilization is often an excellent choice for these situations. It can also be used for stiff backs, sore hips, and even troublesome knees or ankles. The gentle nature of the technique means it can be applied to a wide range of joint issues, from recent injuries to long-standing chronic conditions that have bothered you for years. The philosophy behind this technique is rooted in clinical reasoning. The therapist doesn't just apply a standard move. They are constantly thinking, assessing, and reassessing. They ask questions like, what happens to the pain when I move the joint this way? Or does this specific pressure increase or decrease the stiffness? This process of testing and responding is what makes the Maitland approach so specific and so effective. It is a problem-solving method that seeks to understand the unique nature of your particular joint problem before carefully working to resolve it. So, how does a physical therapist use Maitland mobilization to help you? It all comes down to a system of grades. These grades describe the size and speed of the movements the therapist applies to your joint. Think of it like a volume dial for movement. Grade 1 involves very small, gentle oscillations that you might barely feel. These are often used when a joint is very sore and sensitive. The goal here is not to stretch the joint, but to activate specific receptors in the nervous system that can help to block pain signals from reaching your brain. Moving up the scale, grade 2 movements are a little larger. The therapist will move the joint further into its available range, but will stop well before hitting any stiffness or resistance. Like grade 1, this is primarily used for pain relief. It helps to calm down an irritable joint and prepare it for more movement later on. These gentle rhythmic motions can be very soothing and help to reduce muscle guarding, which is when the muscles around a painful joint tighten up in a protective reflex. This relaxation is a crucial first step toward recovery. When the main problem is stiffness rather than severe pain, the therapist might use grades 3 and 4. A grade 3 mobilization involves a large movement that goes right up to the point of stiffness. The therapist will push into that resistance, creating a gentle stretch on the joint capsule and surrounding tissues. This helps to slowly and safely encourage the joint to move further than it could on its own. It's like gently coaxing a stiff door hinge to open more widely by wiggling it back and forth at the edge of its sticking point. Finally, grade 5 is a small, high-speed thrust that you might know as a manipulation or an adjustment. While this is part of the Maitland concept, the lower grades, 1 to 4, are used far more frequently and are the true heart of Maitland mobilization. The therapist carefully selects the grade based on your specific symptoms and how they change during the assessment. They might start with a grade 1 or 2 to reduce pain, and then, as you feel better, progress to a grade 3 or 4 in the same session or over several appointments to improve your range of motion. Your first session involving Maitland mobilization will begin with a thorough conversation. Your physical therapist is like a detective trying to solve the mystery of your pain. They will ask you very specific questions about your symptoms. For example, they won't just ask if your back is sore. They will ask what exact movement makes it worse, what time of day it feels stiffest, and what makes it feel better. This detailed history helps them form a hypothesis about which specific joint or tissue might be the source of the problem. This initial chat is crucial for tailoring the treatment just for you. Next comes the physical assessment. The therapist will watch you move. They might ask you to bend forward, turn your head, or lift your arm. They are looking for any limitations in your movement or signs of pain. Then, they will use their hands to gently move the joints in your spine or limbs themselves. At this stage, they are feeling for stiffness and listening to your feedback. You will be asked to report any changes in your symptoms as they perform these small, careful movements. This part of the assessment helps them pinpoint the exact joint segment that needs attention. Once the target joint is identified, the treatment begins. You will be positioned in a comfortable and relaxed way, often lying down on a treatment table. The therapist will then use their hands to apply the graded mobilization techniques we discussed earlier. You might feel a gentle rhythmic pressure or a small gliding sensation at the joint. It should not be painful. In fact, if the goal is pain relief, the movement should feel quite soothing. You are always in control, and the therapist will constantly check in with you, asking, "How does that feel?" After a few minutes of mobilization, the therapist will stop and reassess. They will ask you to perform the movement that was previously painful or difficult. The goal is to see an immediate, even if small, improvement. For instance, you might find you can bend a little further with less pain. This test-retest process is repeated throughout the session. The therapist mobilizes, then you move, and you both see what has changed. This constant feedback loop ensures the treatment is working and allows the therapist to make adjustments on the spot for the best possible outcome. The most immediate and welcome benefit of Maitland mobilization is often pain relief. The gentle, oscillatory movements of grades 1 and 2 are specifically designed to calm down an overactive nervous system. They work by stimulating mechanoreceptors, which are painful or difficult. The goal is to see an immediate, even if small, improvement. For instance, you might find you can bend a little further with less pain. This test-retest process is repeated throughout the session. The therapist mobilizes, then you move, and you both see what has changed. This constant feedback loop ensures the treatment is working and allows the therapist to make adjustments on the spot for the best possible outcome. The most immediate and welcome benefit of Maitland mobilization is often pain relief. The gentle, oscillatory movements of grades 1 and 2 are specifically designed to calm down an overactive nervous system. They work by stimulating mechanoreceptors, which are tiny sensors in your joints that respond to movement and pressure. When these are activated, they can override the pain signals being sent from the injured area to your brain. This is known as the pain gate theory. It means the treatment can provide fast relief, even for joints that are quite sore and irritable to the touch. Beyond simply masking pain, Maitland mobilization works to improve your joint's range of motion. Stiffness is a common complaint, whether it's from an old injury, arthritis, or simply sitting in one position for too long. The higher grades of mobilization, particularly grades 3 and 4, apply a targeted stretch to the joint capsule and the surrounding connective tissues that have become tight. By gently and repeatedly pushing into this stiffness, the technique encourages these tissues to lengthen and become more pliable, restoring your ability to move freely and without restriction. Another key benefit is the reduction of muscle guarding. When a joint is painful, the muscles around it often tighten up in a protective spasm. While this is the body's natural defense mechanism, it can unfortunately contribute to the problem by compressing the joint further and increasing stiffness. The rhythmic and gentle nature of Maitland mobilization can help to break this cycle. It signals to the nervous system that the movement is safe, allowing those tight muscles to relax. This not only feels good, but also creates a better environment for healing. Ultimately, physical therapists choose Maitland mobilization because it is a highly adaptable and patient-centered tool. It allows them to treat a wide variety of joint problems with remarkable precision. Because the technique is based on constant assessment and reassessment, the therapist can be confident they are treating the right structure in the right way. Whether the goal is to reduce acute pain, improve long-term stiffness, or simply calm down a sensitive area, the Maitland approach provides a logical and effective framework for helping people move better and live with less pain.